So you're using lasers to treat gum disease. What are the symptoms of gum disease? What is it?
Yes, Randy, we actually very big on gum health in our office. Patients come in with loose teeth, bad breath, bleeding gums, or sometimes they don't even know they have a gum disease. So what
is it? I mean, what exactly is it?
It's a bacterial infection. In fact, what we do in our office, we take a saliva test and we determine what kind of bacteria is present in your mouth, so we could not just attack it with the laser, but sometimes we give certain medication to patients in order to get that under control. There are two ways of treating gum disease. One, we can refer patient to a periodontist who is going to open up the gum and do the surgery and then sew the gums back together, and this way get rid of the bacteria. Or what we offer in our office, we go around with a laser, no bleeding involved. That the laser kills the bacteria and avoids all the bleeding, all the sewing, and ultimately the surgery.
And it's effective?
It's extremely effective.
So once you go around the mouth with a laser and they follow your protocol, they're like bleeding gums go away, the bad breath goes away, things like that?
Yes, as soon as we're done with treatment, and yes, sometimes it might take a couple of visits to get it under control, gum disease goes away as long as they follow up with a home maintenance.
So laser, do you consider this laser dentistry? Is that what you're calling it, or what are you calling it?
Yes, it is a laser dentistry, and it's going to be the future of dentistry.
Now, I have periodontists that have come on my show, and these are key thought leaders in periodontics. And these are guys, since we're talking about this topic, where they were saying they were kind of cutting it out before, cutting out the bacterial infection, which today they'll say it's silly. They use a laser. And they say more and more general dentists are getting the lasers to wipe it out. So this is a big part of your practice?
Absolutely, it is a big part of my practice. All my hygienists that also train to use lasers to get the gums disease under control.
Now, there's supposedly like 20 million people that have false teeth out there, or more. Do you think if you would have met them early with that laser, that you would have eliminated this, a lot of it?
Absolutely. As you know, gum disease is #1 reason people lose their teeth. So if it was addressed 10, 20, 30, 40 years ago with lasers, more people would probably have teeth.
So in your practice, so you do like a swab of their saliva and you're able to look under a microscope? Or you send it to a lab to see what they have going on in their mouth?
Yes, we actually take the saliva test, we send it to the lab, and the lab tells us what kind of bacteria is present in their mouth. And then we give certain antibiotics or certain medication to get rid of it.
Now, for the healthy crowd, let's say the Whole Foods crowd, maybe those people that don't want antibiotics, can the laser kill most of this bacteria on its own?
Yes, most of the time it's the laser itself that gets rid of the bacteria.
So you love it?
I absolutely love it.
Have you done it on any family members, the laser?
Yes, I've done it on my sister.
Is that right?
Yes,
what about
and
you?
I would do it on myself.
Do you think that's the future of dentistry? Where maybe when they go in for the hygiene appointment, they go around the mouth with a laser to kill the bad bugs?
I don't think it's a future of dentistry. I think it's the present of dentistry. Again, every time patient comes to my office for maintenance, whether it is cleaning or whatever it is, we go around with the laser. Yes. And it's much easier and less invasive.